Hi, guys. Hi. I am a little late. I'm sorry. I really like to be on time. But for some reason, every time I do a live, something has to go a little haywire. But I'm here and I'm glad you are too. And I hope you can hear me. If you can, just let me know in the comments so I can make sure that I'm not just speaking to myself. My name is Tamika Duncan, and we're going to be talking about today is medical billing right for me? So I want to jump into it. For those who are watching the replay, put replay in the comments. For you guys, I want this to be an interactive live. I don't want to just be talking to myself. And it's raining here, so it just started raining here. So I hope my connection is okay and that you guys can hear me okay. Again, if you can hear me, please let me know because I don't want to just be talking and you guys can't hear me or if something is not clear or whatever. I also feel I'm really close to the to the camera and I'm trying to move back, but we're just going to jump into this today. So usually I have like a whole elaborate PowerPoint and all these things. I like to be organized and make sure that I don't ramble because I can ramble. But today we're gonna go through a little bit. It's not too long. And then like I said, I want this to be interactive. I want us to talk today. Let's talk about is medical billing right for me? If you guys keep coming back to these lives, watching my videos, maybe you're in medical billing or you want to be in medical billing, and I just want you to ask yourself some questions, understand what medical billing is and all the things like that. So ask the questions that you have and hopefully I can answer them. I always start off my lives just in case you don't know me or you're just jumping in, hopping in. This is the first time that you are seeing me. I just want to introduce myself, let you know that my name is Tamika Duncan. I am a certified professional biller, a certified professional practice manager, and I've been that for over you can do the math. It's on 2013. I got certified, but I've been a biller since 2006. So it's been over, like 17 years or so. My certifications have been 10 years. This year is 10 years because I got them in 2013. And I am also the owner of It's All Medical Billing, which is a revenue cycle management company where I specialize in doing, billing services for healthcare providers. I do credentialing for the United States Virgin Islands providers, and I also do consulting. And my specialty, if you don't already know, is OBGYN. I love OBGYN. That's my favorite. But I have also done ophthalmology. That was the first time I did billing. I did ophthalmology. I have done pediatric behavioral health, pain medicine, and general surgery. So that's my little background. And I also like to throw in, a little bit about myself. Like, I'm not just a biller. I am a biller. I love billing, but I'm not just a biller. So I also love chocolate. And I had to say that because I just came from a chocolate making workshop and it was amazing. It was we did like and I should have brought it in here, but it was a high heels. And in my last live, I let you know that I love high heels. So that was like the perfect combination. Chocolate, and you made the chocolate into a high heel. And then so it was about 2 hours. We made our own chocolate. I love dark chocolate in particular. So I made a dark chocolate high heel. I am the fur mom of a nice, beautiful, amazing fur puppy or a puppy. I'm a fur mom of a puppy, and his name is Cody. And I just came back from the American Medical Billing Association conference. It was on October the 19th and the 20th. I think I have those days correct. But of this year, just got back from that. And it was in Las Vegas, which was my first time going there. So as you guys know, I live in the Virgin Islands. So it was about 7 hours total, I think it was, and the time difference, because we here are on Eastern Standard, and I don't remember what time zone they're on, but they are 3 hours behind. So currently, where it is 6:30 now, it would be 3:30 there, and I was getting all messed up with the time change. Like when it was, because the conference, if I can tell you shortly about the conference, it was 2 days, and it was from like 7:15 to like 5 o'clock. And so when it was 4 o'clock, let's say their time, it would have been 7 o'clock my time in the Virgin Islands. And y'all, I was tired. Like, y'all can tell I'm like, I don't go out and do much of anything, especially not late. So I was getting like so tired. And then though, I would wake up really early because I'm accustomed to waking up like 5, 6 o'clock, which would make it 3 or 2 o'clock their time. So I'm waking up early. I'm feeling sleepy, at the end of the conference. But the conference was wonderful. I'm hopefully going to do a vlog video about it. We took a lot of pictures. I went with my sister, and we had an amazing, amazing time. So just had to tell you guys a little bit about that. If you are in billing, and you're certified too, it is good, because I think I got 12 CEUs, and I got to learn, I got to have fun, I got to go to a different place that I never been to, and it was amazing. So I'm not gonna ramble anymore about that. But I also always let you guys know about my remote one-on-ones. If you are interested in asking me any questions, you want to know anything about, billing, the education, the career in general, all those things, you can schedule a remote one-on-one with me, and the address, or the website address, is on the screen. It's on medicalbilling.com. And then we have the merchandise. So as you see in the picture, we have the cup, which I always drink from. Okay, I'm not putting it in the screen, right? Okay. So we have the cup, and it has Medical Billing Maven. Now, as you guys know, my name here on YouTube is Medical Billing Maven. However, we are all mavens in our right. We are all experts in some form or fashion, especially if we have been in it for some period of time. Excuse me. We are mavens in our own right. So sip your tea, sip your coffee in this mug. I also have and I'm sorry, because obviously this thing is like backwards, so I'm trying to get this together. But this is also a cup, and it's the one that's insulated. You put hot, cold stuff in it. Of course, we have the books, or the notebooks, the little journals. They're ruled, and they have a folder where you can put stuff in the back. Can you see that, you guys? This is a pillow. I have it in this color, which is a blue, and a darker blue. And it says, Medical Billing Maven is the definition. It says, is a superstar at collecting reimbursements submitted to third-party payers, along with patient statements, and a maximizer of revenues for healthcare providers. That is the definition of a maven. So get your pillows. And I have a shirt, which I was hoping to get in frame, but apparently I can't. Ooh. So it says the same thing. And it also says that our special skills, because if you are in medical billing, or you want to be in medical billing, you will know that you need to be an investigator, you need to have critical thinking, and you need to be an outstanding communicator. Okay, so that's our special skills. So please just check it out on the website. You'll be able to see it better there. Like I said, this camera is too close, but I can't seem to get it to work any other way. But I have a pillow and I have shirts, and it, you know, you can wear it and represent. I decided that I wanted to do some merchandise for billers in particularly because I remember a time my sister was trying to get me a gift. I think it was either for my birthday or something. And she was looking all around for different things, and she couldn't really find anything for billers in particular. You know, you can say medical billing, and it people are always saying like medical billing and coding, or they'll have like a coding saying or something. But I wanted something specifically for billers, and I will continue to make other stuff as long as you guys support this that I have here. So just check out the website, see if there's anything that you like for yourself or to gift to someone else. Okay, so we're gonna move on from that and we're gonna jump into, I'm not sure if I should go into or stay in medical billing. Like, is this medical billing thing right for you? You know, that's the question that we're going to try and answer today. So, is it right for you? I'm going to go through some things again, you guys. Please put some comments in there. Let me know what you're thinking, how you're feeling. But we're going to start off with the most important thing I think most people ask. And we're talking about the good, the bad, and the ugly, because there's always all of that in anything. So in medical billing, there is that as well. I'm not here to bash it or anything because you guys know I love it, but not everybody loves it. So I'm here to talk to you guys truthfully about medical billing. So let's start off with salary, because salary as a medical biller can be, it's not something I can say, well, when you start out, if you're certified, you're going to get paid this. If you're not certified, you're going to be paid that. It does not work like that. As a medical biller, there are a lot of what's the word? There are a lot of, well, I can't get the word, but there are a lot of different let me slow down because I'm kind of like all over the place. But there are a lot of criterias or things that you would need that would say how much you're going to get paid. So I might be getting paid something now. I might be getting paid something different from you when I started, from when you started. But for the most part, let's say if you work for a small private practice, they might not be able to pay you as much as if you worked for a hospital or a bigger practice. Excuse me, let me take a drink. So you might start off as a biller and you might be making $15. But if I started off, I might be making, let's say I started off and I was making $22, and you want to know, well, why? You know, I keep hearing all this stuff about billing and people say you make a lot of money, but I started off and I'm not making barely anything. It just all depends on your location, the specialty that you're working for, the facility or the practice that you're working for. There are a lot of different things that determine how much you're going to make as a biller. Hi, Brandy. How are you from Rhode Island? Hi, thank you for joining me. That name is new, so thank you for joining me from Rhode Island. Yes, so there are a lot of different reasons or ways that you can get paid different amounts. So also what I have noticed as well is as a biller, sometimes you start off you're doing billing, but you're not only doing billing. You're doing billing and you're doing coding, or you're doing billing and you're doing practice management, or you know, something like that. And if any of that is the case, then you will get more money, or you will get, you know, a different amount of money to start off with. So salary is something that is going to be determined by the facility, your specialty, like I said, different things. So don't use the fact that you're a biller and how much you're going to get paid or you think you're going to get paid as the only reason why you want to be a biller. Sorry. Do not use that as the only reason, because if that's the case, you might be disappointed. Give me 1 second. I think this fan is just really messing me up. Sorry, I think the fan is really messing with my throat, so I have to turn it down because I'll be coughing over here. Hi, Jerry from South Florida. How are you, Jerry? How are you? Thank you for joining me. So, if any of you guys who are on here know about or want to respond about salary, please do, because like I said, I can't give you a specific amount, but salary will definitely be different for everyone. Let me move this out of the way. Okay. So yeah, salary. Ooh, excuse me. Salary will definitely be different for everyone. Then we have traits and characteristics. So as far as the traits that you should have, like I said, on the pillow that I have here and on my shirt, it says you should be an investigator, a critical thinker, a communicator. Now, that's just 3 of them. But that's real traits you should have. Communication is going to be really, really important. You guys, I'm sorry. Whew. Okay. So communication is going to be really, really important because you're going to have to know how to speak to patients, how to speak to the provider, how to speak to insurance companies. You're basically how to the front desk, everyone. So you're really going to have to hone in on your communication skills. And you guys, I'm so sorry. Give me 1 second, please, because for some reason, I don't know what's going on. Okay. So sorry. So sorry. Okay. So you're going to have outstanding communication skills. It's just what you're going to need to be a effective and a good medical biller. When, depending on the duties, which we will get into in the next one, you may or may not have to speak to as many people as I just said, like the provider, the coder, and all of those things. That just depends on what your responsibilities are. But if you're an end-to-end biller, then you will definitely need to have all of those. You need to have the skills of a communicator, or you need to have, excuse me, you need to have good communication skills in order to communicate with all of those individuals that I stated. Okay, Brandy said that she's coming from a clinical background and decided to get certified in coding, having no experience. Recently got a job, follow up, so it's all very new. Okay, great. So you said 2 things, and I want to go deeper into that because Okay, so billing and coding, I guess we kind of all know this. Every time I have a live, every time I have a video, I usually try to state this, but a lot of time the jobs that we get, they will say they will have a title, and then we get in the job and the responsibilities that we have are not, they don't coincide with what our title are. So when you say or what our title is, sorry. So when you say follow up, Brandy, what do you mean? Are you following up on claims? And do you code the, like, the visits and the procedures and stuff, or you're just following up on maybe denials? Or explain to me what you do, because it is it has confused me for a while, especially when I first started it back in 2006. I just was not sure what it meant to be a biller and a coder. Like, were they the same things? What are we talking about? Yes, follow up, nothing. Oh, okay. Okay, so I got you. Yeah, see, so she said coding, follow up with coding, nothing to do with follow up, nothing to do with coding. Okay. Yes. So see, and did you want to get into coding? That's the other thing, because a lot of times we want to get into a specific one. Like, maybe we might not want to be coders, or we might not want to be billers. We might want to be one or the other. Now, regardless of if we want to be one or the other, we should know or have a familiarity with both. But we might want to do coding specifically, or want to do billing specifically. So when you're applying for these jobs, or when you're taking these jobs, just look at what your duties are going to be, and that can help you determine whether or not this is a good fit for you. Um, so we talked about the characteristics and the traits. Um, as far as being like an investigator, I say that as a joke, and then I say that seriously, because as a biller, you need to be able to find the resources that you need, from payers, from different organizations, in order to get the claims paid. Not all payers use the same rules and guidelines, and you really do have to be an investigator. You are also dealing with patients, so you have to research information about that, figure out things about that. So you're basically researching and investigating. And that's actually what I really do like about being a biller, is the fact that I have to investigate, figure out stuff. I get so happy when I find out something and I get something paid or figured out, and I'm like so ecstatic because I actually got it paid. So I just love that. So Brandy said, yes, I did, but had no experience, so I took whatever I could. Yeah, and that's that's fine. That's totally fine. Get your foot in the door, get yourself in there so that you can then be able to move up. Not to say that you doing the follow-ups is not going to help you. You might not necessarily be doing the coding at this time, but eventually you keep working at it, you'll get there, and you will take some of the skills that you've learned in the follow-up. You'll get to know what payers want and what they need, what they're looking for, stuff like that. So that will help you out. So don't take that as a bad thing. I was just asking because sometimes people get confused as to like I said, what billing and coding is, what their position is, all of those things. So that's a good thing. Get your foot in the door. And then we have Anthony. Oh, hey, Anthony. Hey. Hey. Yes. So thank you for joining. So yeah, but you have to have certain skills. I always like to say that sometimes the coders don't really need to, and this is not everybody. let me just put that out there. You can be a coder and have this is, this type of skill. You can be a biller and have another type of skill. But you, for the most part, coders don't necessarily have to deal with insurance companies, deal with patients. They're kind of more just dealing with the charts, maybe talking to providers, stuff like that, but they're not dealing with all the people that I spoke about, like front desk, all of those people. That's for the most part. Again, if you are end-to-end biller, you will have to do stuff like that. So let's talk about the duties and the positions. So as far as the duties as a medical biller, again, they change. All the practices that I have worked for, I have been an end-to-end biller, meaning I submit claims until collections or refunds. When if you work in a hospital, you may just do one point, like you may just be a payment poster. Sorry. Yeah, I don't know what's going on. But you may just be a payment poster if you work for the hospital. So it just depends on what your position is in or as a biller. We don't all do the same things. And you may also be a medical biller and a medical coder. Now, to tell you guys what's the difference, a medical biller, well, let me start off with a medical coder. A medical coder, they are the ones who look at the charts, they read the doctor's notes, and then they convert them into the CPT codes and the ICD-10 codes. Excuse me. The billers, we then take those codes and we send them on a claim form to the insurance companies, and we try to get the providers paid. So if there are denials, if the patient hasn't paid, things like that, we're the ones who deal with that. So me as a person could be the biller, the coder, and the biller. Or I might just be the biller, or I might just be the coder. So I can have many positions. I'm so sorry. But as far as for myself in particular, I am a biller and I am a practice manager. So I do I know the complete revenue cycle. I have employees, so I have to really deal with the front desk, and then I do all the other things of practice management as well. So I do not do the coding portion. The providers that I work for, they code for themselves, which is another way. But as a biller, I need to know these codes. I need to know how to basically kind of like code, because when you have, that's one of the I guess the bad and the ugly. Because if you are just a biller and you really don't want to do coding, you might find it like, well, I don't want to deal with it. I don't have to deal with coding. The provider needs to know this information. Excuse me. But you as the biller need to know how to code. Long and short of it. I really apologize. I do not know why I am coughing so much. When I talk so much, or and I haven't even really started talking, but for some reason I'm just getting this tingling in my throat. So I apologize. I gotta get myself together. But so You might have to code as a biller, but all of that you need to know when you take the position, when you decide that you're going to work for a company or not. Let me look at some of these comments. Oh, thank you, Jerry. I do not know why I'm coughing. Brandy, I don't know. I don't know if I'm okay because I'm just like I'm getting this tingling in my throat all of a sudden, and I realize that I can't talk a lot for some reason. I don't know. Every time I do, I start to kind of get a cough. But I'm trying to get myself together. Okay. So let's move on. Let's move on to investment. So as as a biller, you're going to have to invest in yourself. Now, you don't want to leave it up to the provider or the person that you work for to supply you with education. You want to be able to excuse me. You want to be able to um, invest in yourself, learn more, learn about the guidelines, because as we all know in healthcare, you things change all the time and you need to stay up on your education. So you're going to have to invest in yourself, in your education. So yeah, I don't know. I'm probably going to have to do this another time, but I'm going to try and push through it. But you're going to have to get some education, whether or not you get certified in billing or not. You don't have to be a certified biller, but you can if you want to. Let me look at the. I just started coding in my class and I'm not getting it. It's the first time there are cases on CPU certification. Yeah, there are, I think, like, as far as for AAPC, I think there are like 10 or so cases. Of course, for the CPC, I think it's like 100 questions. So what are you having problems with when it comes to the coding? Depending on what that is, you may have to really hone down on trying to whatever you don't understand, try to get more resources, try and figure that out. Now, you only need for AAP, I think it's a 70% to pass. So if 10 questions are if 10 questions of it is the coding portion, even if you fail all 10, you would have to get the other ones right. But even if you fail all 10, you probably won't, fail the exam. But I still think that you should be able to learn the coding, and you might not be perfect in it, but you do need to know it, so I understand, Jerry, about the coding portion of it, because I had problems too at the beginning with it, and it was kind of difficult or whatever. I'm trying to get myself together, guys, but I think I'm gonna have to cut this short and maybe come back. I don't know, another day that I have to schedule it. I did pass with a 75. I did take it twice. Yeah. Yes, Brandy. Sorry, I'm not even clicking the thing on the screen. Brandy said 150 questions she think, and she passed with a 75. Great, Brandy. 75. That's good. You only need a 70 to pass. Oh, Brandy's saying she might be able to help Jerry. Yeah, that's a good thing because it's good to have people you can talk to and they can help you out, maybe help you understand it better. So, yeah. Yeah. You guys, I'm so sorry. I was so excited to do this live too, but I don't know what is really going on. And I do want to come back and discuss this topic, but for some reason, something just doesn't want me to be great. And it's not letting me get through this. So I'm so sorry I have to cut this short and we didn't get to go all the way through it. Hopefully I'll be able to come on live again and complete it, finish it, because I have a lot to go through. And I really think it's important that when you get in this profession, because I've seen a lot of people say that they don't think it's worth it. They discourage people from getting into it. And I don't feel that's right because each person has their own perception of what they think is good and what they think is right. And you have to know yourself to know if this is the field that you want to be in. It would help if you know that before you invest so much in it. And I think sometimes the people who are discouraging us or others to do it, they did not do their research. So I really want to go through this. So hopefully I'll be able to go through this again and go back through it. But this thing has got me going crazy. All of a sudden, like, y'all didn't want to see me about an hour ago. I was awesome and great. And for some reason, I keep getting this tingling in my throat now. And I don't know what's going on. But, sometimes things happen. So I am going to cut it short. But I'm going to see you guys again. I'm on YouTube. I usually do videos every week. They come out Saturday at 6:30. And I usually do the lives every fourth Saturday of the month. Maybe I'll try and come on again tomorrow. Get through this again. Let's see what's going to happen with this. But I will put something out in my community post to let you guys know if I decide to do it tomorrow, if I have time to do it tomorrow, and if you want to join me tomorrow. So thank you so much for joining. And I will see you guys hopefully in my next live. Thank you.